BPPV is one type of dizziness that is especially disconcerting because it comes on suddenly and with such routine activity. Any sudden tilt of the head, looking up at the top kitchen shelf or washing one's hair in the shower, can bring on a topsy-turvy sensation. You suddenly feel as if you're not quite sure where your feet are or where the ground is. BPPV. B stands for benign, because it is not a serious cause of vertigo like infection or malignancy. P stands for paroxysmal, which suggests the bout lasts for short episodes, typically 20-60 seconds, and a sensation of lightheadedness may persist for several hours. P stands for positional, because the vertigo is dependent on the positions of your head and neck. V stands for vertigo. The symptoms of benign paroxysmal positional vertigo are almost infinitely varied. They can be severe or mild, long-lasting or brief, complex or simple, frequent or rare. The good news for patients is that in most cases, dizzy spells can be prevented or controlled with medication, exercise or time. Inside each inner ear are 3 semicircular canals that sense rotation of the head and 2 tiny sacs that sense vertical and horizontal motion. Each sac contains calcium granules, like microscopic grains of sand floating in a gel. When the granules, called otoliths, are pulled by gravity, as in an elevator, or acceleration, as in a subway car, against sensitive nerve fibers, they remind the brain which way it is moving. If the inner ear is disturbed by injury, infection or a loss of blood supply, the otoliths sometimes float free of their sac and land on the sensor in one of the semicircular canals that normally senses rotation. The brain then thinks the head is rotating when it isn't, or when it is merely tilting to one side or moving forward. The balance system is well protected inside the ear. But the very quality that makes it so effective also makes it vulnerable to being thrown out of kilter by a blow to the head, medication, infection or nerve degeneration. Diagnosis of benign paroxysmal positional vertigo usually begins with lots of questions for the patient and may proceed through a battery of tests, of vision, hearing, reflexes, nerves, head movement. If there is any reason to suspect a possible tumor, a brain scan is in order. Mostly, the doctor wants to hear exactly when the dizzy spells occur and what they feel like. Doctors can prescribe a set of exercises deliberately designed to trigger an attack of dizziness so that the brain and inner ear can begin to unjam the confusing signals and overcome them. In some cases, treatment of benign paroxysmal positional vertigo involves no treatment at all besides careful monitoring of symptoms until they moderate or go away. In other cases, it's a matter of adjusting the dose or type of medication a patient is taking for another illness. Heal your vertigo and dizziness permanently in just 15 minutes with these easy head balance exercises, starting today. On this page, I'll explain the vertigo and dizziness exercises in detail and how you can gain perfect balance in as little as 15 minutes.